Welcome back to Sumi's Pedostan. This is Dr. Sumaiyya, a consultant pediatric dental surgeon and a senior lecturer in Satyabhama Dental College and Hospital. If you are new to the channel, kindly subscribe and click the bell icon for notifications. This video is all about what you need to do if your kid's tooth gets knocked out. It could be cricket, football or any other sport, siblings quarrel or even slippery floors or fall from a bicycle or a staircase or even fist fights. There are just 5 simple rules by which you can save the tooth. First rule is to keep calm. Not panic by seeing your child cry or looking at the blood which is oozing out from your child's mouth or any other facial injury. Try to get a gauze piece or a cotton piece as soon as possible and keep it near the region on the inside the mouth where the blood is oozing out or the area where the tooth has fallen out, and tell the child to gently hold the cotton in place until further treatment. Second rule, finding the tooth. Try to find the tooth as soon as possible and try to identify if it is a milk tooth or a permanent tooth. And even if you're not able to identify, it is okay, and pick up the tooth by holding its crown portion. The white portion here where I'm holding on to is the crown. The longer portion is the root. So the crown portion is generally much whiter in color compared to the root. Now avoid touching this root part because it contains a very delicate layer that is required for saving the tooth. And do not hold the tooth or pick up the tooth by holding the root portion. So just hold the crown, which is the small white part in the tooth. Third rule is rinsing the tooth under tap water for just 10 seconds. Next is the fourth rule, where you need to store the teeth in a solution and transport it safely to the dental office immediately. Now there are a lot of storage medias and transport medias, some of which I have mentioned here, but the most common media which we would be able to get around us is milk. So if you could just get cold milk, put it in a container, put the tooth inside the milk and transport it safely to the dental office. Another option is to keep the tooth between the cheeks. You can put the tooth into the child's mouth, just tell him to hold it there between the cheeks or in the lip region or below the tongue in their saliva itself. So it can be transported that way also, so that the tooth doesn't get damaged and will stay safe until the treatment is done. Unfortunately, water is not an ideal media or a storage media to take the tooth in. It's going to damage the tooth and not keep it safe. So do not carry it just by placing it in water. You require milk, which is the most commonly available thing. The child can store it in the cheek or the lip region and pool saliva there so that it can be transported safely to the dental office. The final rule, call your dentist while you're on the way so that they can keep all the necessary materials required for treatment. If you have noticed, I have used words such as soon as possible, immediately, a couple of times in this video. That's because time is the most important factor when a tooth gets knocked out. Lesser the time it is out of the mouth, more better the prognosis is going to be. The more sooner you reach the dental office, the better for reimplanting the tooth into the socket. So you need to multitask, that is, you need to get the cotton or the gauze piece to be kept in the mouth soon. One person needs to start finding the tooth, immediately rinse it, then keep it in the storage media. Someone needs to get the milk as soon as possible. So try to get as much help as you can at that point and reach the office immediately. Generally, the milk teeth doesn't need to be put back into its socket. Only the permanent teeth needs to be put back into its socket. If you remember, I had said try to identify if it is a milk tooth or a permanent tooth. It's okay even if you can't identify. The dentist will do that. Permanent teeth, immediate treatment needs to be done. And if a primary teeth, just The soft tissue injuries such as the lips or any lacerations on the cheek or the chin region, that needs to be treated. Medications would be prescribed, antibiotics or painkillers if required. Tetanus injection based on the place of injury and the site of injury. If required, the doctor would prescribe that as well. So remember these 5 rules and you can save the tooth. If you have any queries, please comment below. Till then,